Today's tip of the day is all about shoulders. And shoulder pain is very common. And there's a number of reasons why that happens. So first, I want to just tell you a little bit about the shoulder. The shoulder is a ball and socket joint, but it's surrounded by a rotator cuff. Now, the rotator cuff is 4 muscles. There's a muscle in the front, 1 on the top, and there's 2 in the back. And what they do is they keep that ball centered in the socket. When people start having shoulder pain, it's usually because there's a problem with the rotator cuff, either the bursa above it or the rotator cuff tendons. So we're going to talk about some ways that you can keep your shoulder strong and keep it from getting into problems. The first thing is stabilizing this shoulder blade on your body. So people have problems with posture. It's very common for people to start walking around like this. So we want to really work on posture and straightening your back and keeping those shoulder blades back. And the way we do that is to strengthen the muscles of the rotator cuff and the muscles that control the scapula or the shoulder blade. The second part that we want to work on is the rotator cuff muscles themselves. We'll start working on some rotator cuff exercises to strengthen those rotator cuffs. There's a lot of benefit to this. The first thing is that your shoulder pain may go away, but also the other recreational activities you may do, such as golf or tennis, may get better because your shoulder's stronger. All right, so here's some exercises for the rotator cuff. This is using TheraBand. This can be obtained at the office if you come in to see us, or you can also get this online or at any of the sports stores around town. But it's just an exercise band that gives resistance. So the first thing is on my right shoulder, I'm just gonna hold tension on the other one, and I'll keep my elbow in, and then I wanna rotate out. And you can see my elbow is staying in at my side, and we're getting external rotation of the shoulder, and that's going to strengthen those lower muscles on the back of the shoulder blade. What we don't want to do is to start letting the arm wing. So we don't want to do this. We want to keep that elbow in at the side and then rotate out. And then after you've done 10 or 15 of this exercise, then you're going to want to rest that right arm, and then we want to strengthen the left. So you keep the left elbow in, again, at your side, and we're going to rotate across like this. And use the resistance bands to help strengthen that front rotator cuff muscle that does internal rotation. Again, what we don't want to do on this exercise is bring the arm all the way across or let it stay out. We want to keep that elbow right at your side and then rotate in. Both of these exercises can be done to strengthen the rotator cuff, and you can do them on either side and facing the other direction. Okay, so these exercises are to strengthen your shoulder blade, and we're really working on your back and your posture. Again, as we mentioned earlier, a lot of people will bend forward and lose their posture. So you want to stand up really straight. You need to engage your core muscles in your stomach and your abdomen, and then stand up straight. And then we're going to row back. So this is a back exercise. I'm squeezing my shoulder blades together, and the bands are giving me resistance to do that. So by doing these exercises and stabilizing your shoulder blade, it will prevent the impingement in the shoulder, and that's the cause of the pain in the shoulder. Plus, if we keep these muscles really strong, we'll stand straighter, and our back pain in the mid-back and lower back may also go away. So these were a few quick tips to tell you a little bit about the rotator cuff and the shoulder and why we get shoulder pain. The exercises can be done on a daily basis to help strengthen your shoulder and work on posture. Again, posture is very important. We want to stand up straight and bring those shoulder blades back, and that's going to help relieve shoulder pain as well as upper back pain.